tilt table. It's for patients who've been bedridden for a long time, and suddenly when they sit or they try to stand, they start getting dizzy, they feel they're going to faint, and so they stop sitting or standing. So this table gradually gets them to get their confidence back. So they're flat, it takes them say to around 45 degrees, then we stop. After we stop, we measure the blood pressure, we reassure them, we say, see now, this is like you were sitting in a chair and you're feeling fine, and now we'll get them up to 90. If they're fine, we'll keep going. So you'll see here that this table, they're fully strapped, they're stable, they don't feel fear, and it takes them right up. Then we'll stop again, and now we'll ask them, are you fine? They'll say yes. We'll see, you're almost standing. They will measure their blood pressure and say, see, your blood pressure is normal, you're not going to faint. And then we'll get them completely erect, keep them completely straight for a while. We'll stop there. We'll see, you're standing, you're virtually able to do this without fainting, without falling, without feeling dizzy. Give them back their confidence. So once this is done, it will probably take a week for the patient to be confident that if we make them stand, they're not going to get dizzy and they're not going to fall. So then we'll get them back to the lying down position. And once they're confident of this, then we can start the walking training. Say for example, the patient, we find that the nerves are not working properly, or there's a blood pressure issue, then we may need to send the patient for nerve stimulation, for muscle stimulation in conjunction with this. Or if there's a reason for the blood pressure fluctuation, we may connect with the team in Chennai with the super specialist and say, is it a heart reason or is it some other reason? Is there some medication that needs to be tweaked? And so this is the reason why we say it's a multidisciplinary approach. Principally began as an accident hospital purely for patients who had injuries or who had deformities following accidents, road traffic accidents, etc. And from the beginning, our rule was that everybody who works at MIOT has to be full-time. And then slowly from that, the hospital grew to a hospital which had 5, then 12, and then over time to 63 different specialties covering everything from organ transplant to cancer to neurosurgery to gynae. From 2019, we've been exploring our relationship with Mauritius, and yes, post-COVID, for the last 3 years, we've had a small information office here in Port Louis, and patients who find that they need some kind of complex treatment that's not available in Mauritius have chosen to come to South India, to Chennai, to MIOT hospitals. Obviously, we've looked to see what kind of facility would be meaningful, which is unique and which currently does not exist in Mauritius, before planning to open such a new facility as we have now. The concept of rehabilitation is an international, worldwide concept. Patients have certain specific treatments in hospital, and then they need certain specific kinds of post-treatment protocols to get them back to normal activity. Today, a lot of patients we did not think would survive are surviving complex treatments. Elderly patients are living longer. Younger patients are more demanding. They want to go back to more normal activity, and none of this is possible without rehab, and especially so in patients with neurological conditions like stroke or brain tumors. They cannot get back to normal life without protocol-driven, multidisciplinary rehab. So we've been receiving a lot of patients from Mauritius with problems in their brain, patients who've had a swollen blood vessel called an aneurysm that may need some preliminary kind of treatment for that blood vessel, patients who previously had a tumor growing in the brain that need radiation treatment, also youngsters and young adults with injuries to the back, injuries to the spine, previous surgery to the spine. A lot of these have not recovered fully. And also, being in Mauritius now for 3 years, we've seen patients who treated in Mauritius, treated well, but not fully back to activity, especially people who have had sports medicine to the upper limb, to the shoulders, sports medicine treatments to the knees, knee replacements, a whole gamut of patients that feel that they're not able to get back to normal activity and normal life. And seeing that at MIOT Chennai, we have the second largest rehab center in India, and seeing that we've rehabilitated in the last few years over 3,000 overseas patients very successfully without rehab, most of the time the surgery that you've had, the treatment that you've had will only take you halfway towards your target, the goal that you want, which you term recovery. So because this sort of comprehensive multidisciplinary team does not exist, we decided that we should put together such a scenario in Mauritius, where there are speech therapists, there are swallow therapists, there are occupational therapists, psychologists, physical medicine specialists who are qualified doctors who've done a master's in physical medicine, physiotherapists, all working together as one to make sure that the patient achieves their goal, which they feel gets them back to normal unrestricted activity.
The one in front of me.
Yeah, exactly.
From the legs, okay? First the legs.
Very good.
You place it on the there. I just hold it. Bring it to the
Yeah, very good, very good. You're doing it. Excellent. Well done. Drop it, drop it. Drop it on there.
I bring it to back. Place it on that.
Yes, that's it.
More down, more down.
So again, people find physiotherapy or any physical therapy, or even people for fitness, when they go to the gym, they find it boring, and therefore they do it once and then they don't want to do it again, or they do it 3 times and then they stop. So this makes it interesting. It gives you a target, it gives you points, it gives you a feeling of achievement, and therefore you want to go back again and again. So imagine somebody is paralyzed on one side, or they find it difficult to use their hands on both sides. So this is a game where you have to bend and you have to pick something up and put it somewhere. So in the beginning it may be difficult for you. In the beginning you might find it difficult to reach, you might find it difficult to lift, you may find it difficult to correctly place. So all these combination of movements are being done. Based on which side is weak, or if both sides are weak, it can be done. So this is a sort of visual reality. What we are seeing is 2-dimensional. The person who's wearing the special device on their head, strapped so that their eyes are looking in, will feel like they're sitting inside the game. And although they have weakness, because they can see a 3-dimensional version of something that is happening as if in real life, they are able to achieve what they want because they feel they don't really know that it is their hand that is doing it. The type of disease ranges from patients who've had a stroke, where they get paralyzed, who've had problems because they were born with a birth defect. They may have been born with reduced oxygen supply to the brain. They may have been born with cerebral palsy. There may be children who are autistic. There may be young adults of professionals who sing, who teach, who suddenly find they have a problem with their voice. There are sports people who find that they've had an injury and they're not back to full mobility. A lot of patients who are elderly also we find who have lost their confidence. They're in bed for a long time, they're at home for a long time, they're afraid to stand, they're afraid they'll fall because they think they don't have balance. So this entire range of patients will hugely benefit from rehab, and the rehab is not long term. Usually you need around 42 days of rehab, or at the most 90 days of rehab after assessment by the multidisciplinary team. So this machine is called the Gait, and it's for people who have regained a little bit of power in the lower limb. So the power is measured on a scale of 0 to 5. So the person has maybe 2 out of 5 power. The person really finds that the leg is not strong enough to make them walk. They find that maybe they'll fall, they can just about stand. Now this harness is removing some of the gravity by supporting the person, and you can see a lot of the weight is on the trunk, that is the upper body, and on the arms, and you can start the treadmill at whatever speed you want, initially very slowly, so that if the person has got grade 2 power, which is quite low, slowly this will start strengthening the muscle. And once you feel that the person has got the power going to maybe 4, then you detach it from this treadmill. So basically this has got locks here. So we could stop the treadmill, we could detach it from the treadmill, we could take the whole frame out to the floor, and then the patient can start walking with some gravity assistance once they reach power 3/5, and slowly they'll go to the full power 5/5. So once they get to 4/5, we will take off the harness and then they'll be walking without the harness. Technology has been mind-boggling, has been a game changer in rehab. Right from visual reality exercises to gravity cancelling devices so that you can be suspended and walk if you have very weak muscles. Patients with paralysis can be made to stand with great confidence using tilt tables. Patients who've never walked before can use special mobility devices like the balance device to make sure that they have equilibrium, the get up and go device to make sure that they have confidence in their walking techniques. So there are so many devices today which help regenerate and recover from muscle weakness. There's Faradic nerve stimulation, galvanic stimulation. The list is endless, and it's all available here in the MIOT Rehab Center in Mauritius. We have a mix of doctors and nurses, both local and from Chennai. So certain skill sets of allied health professionals that are available here, and you have a complement of people from Chennai with specific areas of skill like nerve conduction specialists or occupational therapists to supplement the existing staff here. Things that is required when you need a multidisciplinary approach is to access in real time when the patient is sitting next to you the specialists that you want the patient to consult. So we have a next generation telemedicine kiosk which can connect to any diagnostic device that the doctor wants to see. So let's say, for example, something very simple to understand is, say we want a heart specialist to consult the patient. We can plug the echo machine into the device, ECG into the device. We can get the patient sitting there. The stethoscope can be put on the patient, and the cardiologist sits in Chennai and does the consultation in real time, listening to the stethoscope, looking at the ECG, viewing the echo images, discusses the diagnosis with the patient, and discusses the treatment. What we're going to do is just going to demonstrate to you how the doctor sitting in another country, in this case in Chennai at MIOT in India, can view areas that he wants to look at. Say for example, he wants to look at the skin, then we can use this instrument called the dermoscope, where you take this glass which will magnify, and you basically, say for example this is the skin, you look at the image, you can fine tune it so that you get as good clarity as you want. So there you are. So now if there's a lesion in the skin, they can see it very clearly. They can share it also with Chennai. Secondly, suppose there's a lesion in another part of the body. Say for example they want to look at your mouth. So if they want to look at your mouth, if you've got a head and neck cancer or if you've had treatment in your mouth, so they can use this thing to go in and look at your mouth. Say for example they want to look inside your ear, then we can use this instrument to look inside your ear, and the doctor can even capture the image if he wants. So I'm just going to put it, can you see Dr. Samir? Can you see my ear? Yeah. Okay, can you capture it now?
I would need that in your cavity, yes doctor. I'm just going to capture that.
Now you can see that the doctor sitting in Chennai has looked at the image, and now maybe the doctor in Chennai wants to point out something in the image that the patient has to understand is the problem. So then the image can be called up. You can see, look at the clarity of the image. You saw the image that we were transmitting. Now once it goes to Chennai, it can be further played with. They can make it even clearer. Look at this other image. They can even circle the area which has got a problem and say this is the area that needs to be treated. So this is the sort of real-time, meaningful telemedicine that we have installed here for the people of Mauritius. So suppose, for example, over here in Mauritius you have a surgeon who's operated on a cancer in the patient's neck, and now they need to send the patient for radiation. they need to plan the radiation, they need to make sure that the radiation is done without affecting the surgery area. So the cancer should be treated so it doesn't come back, but the surgery area should be left so that it doesn't break down during treatment. So such things with the patient sitting there, with the surgeon sitting next to the patient, you can talk to the radiation expert, you can talk both to the physicist who is deciding how much dose the patient gets. At the same time, you can talk to the radiation oncologist who is deciding on the software of the machine, how much dose will be given, where it will be given, how deep each therapy will take, how many days it will take, what are the things that can happen and what are the things you can do in Mauritius before you go to India to prevent them from happening. So when all this is discussed, the journey of the patient becomes very definite, the difficulties that you may encounter become less, and at the end of the day, there's a successful treatment because of collaborative care. When we look at Mauritius itself, we see a lot of success stories that Mauritians have had with rehab after coming to India. So patients from Mauritius who've had brain tumors, patients from Mauritius who've had aneurysms in the brain, swollen blood vessel, they have had treatment for this. Sometimes they've been paralyzed on one side. Sometimes you have teachers in Mauritius who've had the same problem. Now they need to go back to teaching. They need to use their hands. They need to write on the blackboard. These are people that we've rehabilitated. They've been very excited by the fact that they can get back to their normal lives, to their livelihoods and support their families.